Okay, I think we'll get started as more people join us. First of all, welcome everybody. My name is Archana Dwavedi, and I'm pleased to welcome you to UNICEF's webinar series on data collection, which is organized by the Data Collection Unit, Data and Analytics section at UNICEF. Today's webinar is entitled Ethics in Remote Survey Data Collection. And I'd like to mention that today's webinar will be the last in this set, which was started in mid-April, and we managed to do 10 webinars in 11 weeks. We do plan to continue these after a pause of a few months. We're very excited for today's webinar, but before we get started, a few housekeeping rules. We've scheduled about an hour and a half, starting with the presentation, which is a panel this time, and it will be followed by an open Q&A. As always, throughout the webinar, kindly remain muted, and we will please write your questions in the chat box. This webinar is being recorded, and it will be available on our SharePoint site, together with past webinars, which you can find the link in the email that you had received. We do plan to have these posted onto our public site, which will be available very shortly. I will now hand it over to our facilitator for today, who is Eva Quintana, to introduce herself and the panel members. So Eva, over to you.
Hi, hello everyone. Hello from sunny New York City. My name is Eva Quintana, and I work with the Global Mix team in the Data and Analytics section in headquarters. And today, as Tatjana was saying, we'll be facilitating this webinar, and our webinar will be a panel discussion with a duration of about 45 minutes and followed by an open Q&A. And the first thing I would like to do is to introduce our panelists today. We have 4 UNICEF colleagues joining us from different corners of the world. We have Gabrielle Berman. She is the Senior Advisor in Ethics in Evidence Generation with the Office of Research. I believe she's joining us from Florence, Italy. Hi, Gab. We also have Tom. We have Tom Pellens. He's an evaluation specialist with Regional Office for South Asia. I believe joining from Kathmandu.
Hello, everyone.
We also have Hrayr Wannis. He's the monitoring manager with the Regional Office for Eastern and Southern Africa, joining us from Nairobi, Kenya. And hi, Hrayr.
Hi, everyone.
And we have also Tatjana Karaulac. She's a statistics and monitoring specialist with a mixed team in the data analytics section. Hi, Tatjana.
Hello, everyone.
So what's going to happen today is during the first half of the webinar, Gabrielle will be addressing questions from Tom, Hrayr, and Tatjana. These questions are all based on ethical challenges that they have experienced while implementing various remote data collection activities. And then after that panel discussion, we will open the floor for a Q&A session. If you want to share any comments and questions in the chat box during the panel discussion, please feel free to do so. I will be monitoring and compiling your contributions for discussion later during the Q&A, the open Q&A. So just a few thoughts that I wanted to share about ethics in data collection to just give a little bit of context to our panel session today. When we talk about ethics in data collection, we talk about this idea that anyone, when we are interacting with human subjects, right, with people, to obtain information about them, like when we interview survey respondents or when we interview participants in a study, we have a responsibility to consider any potential negative impacts that the collection and analysis of their data may have on them, right? So ethics in data collection, for example, require that survey managers put protocols in place to monitor and to mitigate those potential negative impacts. And things like informed consent and privacy, confidentiality are all part of this effort to ensure that participants are treated with respect and to make sure that the benefits from participating in a survey or in a data collection activity outweigh any of the risks or potential risks or harms for the participant. Now, these principles apply to any data collection activity in general, but today we want to narrow down and focus on methods for remote survey data collection. And I would like to ask Gab to share a few thoughts about why and how ethics matters, in particular in the context of remote data collection. So Gab, over to you.
Thanks, Eva. And I mean, much of what you've already said kind of basically are the key issues. It's about being thoughtful. It's about thinking about the implications. We always have ethical challenges when we collect data, but when we start moving to remote surveying, we start with greater complexity in terms of how we engage the informed consent and some of the issues that Eva raised. I think one of the main things that I wanted to say is just to be mindful that while we're talking about ethics and remote surveying, we need to be very clear that ethics is situated. So it's necessarily contextual. So in terms of how you respond, it's determined by your specific circumstances, the nature of the technologies you're using, the populations that are engaged, etc. So ethics isn't necessarily about the right answers. It's frequently more about the right questions, which our panel are going to pose today. And I've got to say that I'm particularly grateful to have those that are here, because I've engaged with all of them around some really kind of thorny questions in relation to remote data collection. And really, they've been kind of really thoughtful when they bring their questions. And I think that's a really great starting point. Once we know what the questions are, we can start looking at the harms and the benefits, being very mindful that easy, simple, obvious answers aren't necessarily there. These are new technologies. There are great complexities around it. The best that we can do is really just weigh up the harms and the benefits and understand what the realities are in the field, what are our needs, and what is critically important, what we're hoping to start today, is a conversation. So please, at the end of this particular discussion with the panel, we're going to open the floor for questions. And I think for me, this is the starting point at which we start to really engage and understand what the ethical issues are, being mindful that there are not obvious answers. So the conversation is so absolutely critical. Thanks, Eva.
Thanks, Gab. So I think I'm going to now ask our panelists to share maybe a bit of background briefly about that remote data collection activities that they've been involved or they are currently involved with, and then after that we'll just start our session with our questions. So maybe Tatjana, would you like to start, please?
Yeah, thank you very much. It's a pleasure to be here with you to discuss such important topic. So let me just briefly introduce what we are doing. The Mix Global program is actually conducting Mix Plus for now in 2 countries, in Georgia and Mongolia. Mix Plus is a household survey conducted over the phone. The important for our topic today is to understand who are households that we are calling. So there are 2 possible sampling frames for Mix Plus. One is a mix or any other household survey which collected the phone numbers and consent from the household to call them again later. So those are face-to-face surveys, to be clear. And then the second possible frame is actually any population or household register with phone numbers to be able to call those households. Respondents in our surveys are adult people, so over 18, and in special situation, it can be 15 to 17. If they are emancipated and living alone without adult supervision. And so we have 1 respondent for the interview. This is respondent who answer on our phone and give us a consent to continue with the interview. The duration of our interviews is usually 6 to 12 minutes, according to our data that we have by now. Questions that we ask can be related to respondent directly about this person's opinion or situation in the household. It can be connected or related to other adult household member, which is randomly selected from the list of household members, or it can be related to children in the household. Please bear in mind that even if we ask about children in the household, we are not talking to children ever. So those are not our respondents. It's always adult household member, regardless of the questions we ask. at the beginning of each interview, we are asking for a consent to continue with the interview. Also, we are giving explanation to the respondents saying that even if they say yes at the beginning, they can stop the interview whenever they want. If they feel uncomfortable, if they want to skip the question, if they don't have time, whatever the reason can be. So they can refuse in any moment. Also, what we introduced, and it proved very useful for us actually, we asked them if we can call them next month. So we are not assuming that if they say yes, this time, that we can call them again. So we are asking them if it's possible to call them next wave. The other thing that we also introduced is even those respondents, because I missed to explain this at the beginning. This is a longitudinal survey. So we are selecting the households and we are calling them usually 12 months, each month one time. So at the end of the interview, we ask for next call. We ask also those who refused interview at the current time. So let's say I'm calling you and then you are saying, I don't have time, I don't want to answer your questions. But still we are asking, okay, you don't have time now. Can we call you next time? We are also emphasizing, even they say yes for next time, they can refuse when we call them again. Also, phone numbers that we are calling are confirmed at the end of each interview. So we are asking, okay, is this the best number to call you again? And if not, we are asking them for additional phone number if they are willing to give us. This is actually the most difficulties that we are facing in our survey is actually getting these phone numbers. But yeah, we will have some questions for Gabrielle, and let's hope she will be able to clarify some things for us and to help us. I just want to mention, because it's really important, the questions that we ask to our respondents, we are really taking care of the privacy issue and also sensitivity, because as you know, not all questions can be asked even in face-to-face survey. Using the phone, it's even more difficult and more sensitive. So I will stop now, and yeah, we will talk more. Thank you.
Thank you, Tatjana. Tom?
Yes, good evening, everyone. Hello again from Kathmandu. Thank you so much for inviting me. I have the feeling, while ethics has always been at the front of our minds when we're doing evaluation, the past year and a half, it's been almost continuously on our mind day to day with all the remote data collection that we've been thinking about. I'm not gonna refer to any specific initiative like Tatjana did, but let me explain a bit several initiatives that I've been involved in. One group of initiative was the implementation of community rapid assessments, which was an initiative that was launched by the evaluation office and the C4D team from headquarters. And it was not only promoted and supported in South Asia region, but also in some other regions. And this was an evidence data collection initiative to collect social and behavioral data at community level during the pandemic, and in a longitudinal way, to really create a time series data set to understand trends and also change questions and gather information along as the pandemic changed, to have that longitudinal data set. And it focused on trying to get data on people's preventive behaviors, on people's coping strategies, information strategies, how they were accessing information around COVID-19. And in our region in South Asia, it was implemented in 4 countries: Afghanistan, Pakistan, India, and and Nepal, using different data collection modalities. Some used IVR and online, others used phone surveys. In some countries it was 6 rounds, in other countries it was 3 rounds. So a variety of methodologies and also different sampling strategies that were used. So that was one set of initiatives that I got involved in, and the regional office supported. On the other hand, we saw actually a diversity of rapid assessments being rolled out at the start of the pandemic. Some of them were one-off really at the beginning, some were iterative, continuing for months. And for example, in your country office alone, more than 20 rapid assessments were identified and rolled out, even more probably. And we saw a lot of experimentation with remote data collection, using different sampling strategies, again, using different data collection modalities, addressing different topics with different respondents. So what we did at the regional office was, okay, we need to learn from this, because this is not going to stop. This emergency context will continue. So we launched an initiative to document and analyze a set of case studies of these rapid assessments. So we selected 9 case studies of rapid assessments and real-time monitoring exercises from 6 countries, and we analyzed them, and we looked at more at the how rather than the findings themselves. Particularly we looked at data collection strategies, sampling strategies, but also partnerships, how partnerships were formed, the use of the data, and ethics came in, of course, all the time. And we saw that because the choice of these data collection modalities, the choice of the respondents, the type of information that you were asking, every time ethical questions came up. And I'm also very grateful for Gabrielle to always be there to answer our questions. So my questions that I will launch to Gabrielle again, will be drawing on all of these initiatives. So I'll stop there and hand it over to you, Eva, again.
Thank you, Tom. Hrayr?
Thanks, Eva, and again, thank you everyone for this very, lovely topic. This topic is, again, as everybody said, it's core nowadays more and more to everything we do, and specifically with the pandemic. Not to also repeat, I think I share a lot of the experience what Tom was mentioning from a regional perspective, where working in the regional office, we saw the plethora of countries launching this kind of rapid surveys and phone surveys and IVR and so on and so forth, and just growing out of hand. And that was also a key aspect for us. But I think we all understand the reasons why we ventured into such data collection efforts in such a critical time. From my experience, for what I'm going to try to also reflect on for my questions to come, was a particular experience from the regional office that we also launched a multi-country rapid phone survey. This was, again, the context, as we all know, it was the beginning of the COVID. The impact on children, we're still not aware, and the discussion and the rhetoric globally was not yet on the children. So from the regional office perspective, there was a push that we try to understand how is COVID impacting children at the household level. So that was the background of us. So we launched this 5-country phone surveys to try to get an idea at the household level, how were the different impacts on children happening. I think, as I said, there's a lot of already been things going on the country level, and a lot of the questions were coming up. But one thing maybe perhaps additional to what we went up with the partnership aspect was to work with a private sector company. So there's polling agencies from specifically with Gallup, to work with Gallup and to try to see, because as I said, the key point was here rapid, and meaning that we already should have the networks and the partnership to venture into multi-country at once. So basically my questions are stemming from those, but it shares quite a lot of the issues that come from that selection and the decisions around what sampling frame, how are the mode of the interview going to be, what are the different implications when it comes to ethics in different types of modalities when we're engaging through the phone and reaching households and so on and so forth, and what do they represent, especially the numbers, are they households, are they people, are they households with children and without? So a lot of different questions come up as we were discussing with Gallup, and I think there's a different dimension as well, working with the private sector around this. Where is the boundaries of who's accountable to what and how much we should, drill down? Because also Gallup by itself is subcontracting companies within countries and so on and so forth. So it becomes pretty complicated, and we need to follow up this. So one of the key, for us, I mean, learning was how do you also ensure the ethical conduct and you know, monitor that they're applying the ethical conducts that you agreed with from the beginning is another dimension that was pretty interesting. But anyways, I'm really happy to take forward the discussion. Without further ado, over back to you, Eva.
Thank you. Thank you very much, Hrayr. Thank you, everyone. So I think now we're ready to start our round of questions, and we have about 35 minutes probably left for the panel discussion before we open for Q&A. And I want to remind everyone again that, you know, please feel free to share your observations, comments, reactions, questions as the panel during the panel discussion. We'll be monitoring the chat box. Tatjana, over to you. Your first question to Gab.
Thank you, Eva. Okay, let's start from the beginning. Who we can call? Yeah, so as I mentioned, for us at least, there are two possible main options. We can call the household from household surveys where we collected the phone numbers from them. And yeah, we have two branches here. Sometimes in Mix, for example, we are asking for consent to be called for Mix Plus. But there are other surveys with phone numbers without such information provided to the respondent. So is there any difference there? You know, because people gave their phone number, but they don't know who will call them and for what. Can this create any ethical issues? And how this compares with when we use population register. So we have phone numbers from the government register, but these people don't have a clue that somebody will call them for a survey. Again, I just want to emphasize that at the beginning of each survey, we are asking for a consent. So, and this, of course, it's connected to other than questions, but yeah, let's stop here and see what Gabrielle will tell us.
Okay, so I think in the first instance, one of the critical issues is obviously the first and foremost is consent. I mean, we're agreed with that one, and how consent is. So in the context of Mix Plus, which I'm presuming everyone is aware of, that Mix Plus is via the phone. In the context of Mix Plus, they've specifically asked for a number for that household, in which case, so the consent is there and it's very clearly marked, they've said yes to it. That doesn't mean that when you actually, you know, when the enumerators are effectively on the phone collecting the data, that they don't have to ask consent again. I mean, this is actually an across the board practice, doesn't matter where you've gotten the data from, you have to ask consent at the outset, even if you've previously got consent. But it is better to have previously, obviously, gotten consent. So that's absolutely critical. I think, you know, there is one of the issues in terms of the kind of bigger databases that, for example, it's government, it's unanticipated, then yes, you know, you can do the randomized kind of calling and, you know, according to how you want to sample. But again, you will not have asked for consent. And in that case, and I think, you know, in a number of instances, we're not necessarily going to have the number. And does that mean that given we haven't got the number, we can't necessarily call people? Well, I think the reality is that this is going to happen. We're not always going to have these numbers. So in which case you've got to have a kind of robust consent form, consent process up front. And you can digitize this, or you can do it kind of in a face-to-face mode like you do in Mix Plus. But the idea is it has to be robust. Now, the most robust process, and particularly if you haven't previously asked whether or not you can use the number to call them about a particular survey, is actually to call them, say, this is the survey we're doing, this is what we're considering, are you interested, and when would be the most convenient time to call back? If you want to ask for the standard, the most robust and most ethical approach, it would be to actually give them time to reflect. And then, of course, and also to make sure that you're actually calling at a time that is convenient, being mindful that it's not always convenient. I mean, frequently, so these surveys, and particularly the remote surveys, are a little bit shorter. But even then, we have to be respectful of time. So in this instance, I think we need to say, well, always ask consent. If we haven't already got approval, you absolutely have to kind of, well, what you should be considering is the possibility of kind of asking them to call back and therefore giving them time to think about it again and then confirm it again, and also finding a time that's convenient for them. The thing you've got to realise, and this is perhaps we'll talk about it a little bit more, is the nature of the database and whether or not kind of you are going to be the only one accessing it. Because what happened in COVID, and I was very acutely aware of it, is that everyone was doing surveys remotely. And so, you have to start thinking about the databases you're using in terms of, well, are you basically exposing those who are participating to survey fatigue? And what are the implications for your participation rates, but also about, respecting people's times, which is one of the reasons why, if you do have the opportunity to actually say when is a convenient time to call back, then again, that's kind of part of the process of respect. Okay, thanks, Eva.
Thank you. I think I'm gonna hand it over now to Tom for his first question to Gab.
Well, I actually had a bit of a similar question, so I'm going to jump that gap. Just to say, Tatjana, we exactly had the same issue. When we saw, there was always a question of, okay, how are we going to sample? What will be the sample frame? And in several of the rapid assessments that we had, actually, there was a use of existing survey databases. And then the question was, did these people in this survey database give consent already for a follow-up? Sometimes we knew that consent was given and it wasn't an issue. Sometimes we didn't know that. So what I'm understanding from you, Gab, let's not immediately discard that database then. But just make sure you be very considerate in how you approach it. And of course, I think consent is then of course always key. Am I understanding that correctly? Just
Absolutely.
To check again.
No, absolutely. And it is to kind of, we can use them, but again, as much information as you can about the database you're using is critical. So how frequently is it used? How many surveys are used? I mean, this type of thing, what is the population? Has consent already been sought? I mean, these are the types of things that will make sampling easier, will kind of give you a better understanding in terms of interpretation of the data, exclusion, a whole lot of issues, but also in terms of understanding, are they going to be is the population going to be over surveyed? But we can use them, but again, always ask consent.
Shall I immediately launch another one? Or yep. Because related to consent, and it's related to consent and assent when you do data collection with adolescents. So we had one survey, where adolescents it was a youth survey. And we also had surveys where it wasn't a youth survey, it was meant to be adolescent survey, but it was an online, it was data collection, remote data collection, particularly that was self-administered, which is through IVR and online. So my question is, the issue is that people may, first of all, you ask the age of the people, but you have no idea if this is correct. So often when you say, okay, you want to do an adolescent, not an adolescent, but an adult survey, you ask the age, and then people, and if it's self-administered, you just need to rely then that this is a correct answer. So that's an ethical issue. How do you know what you do? And then second, when it's an adolescent survey, you need to get the consent from the guardian. But how, if this is again a self-administered survey, how do you know that? How can you be sure that any of these processes are actually working in terms of consent of the guardian or the caregiver? And so these are, I don't know, complicated questions, and I don't know if you can share any experiences with when you reach out to adolescents in terms of this issue of really understanding, knowing the age, and really understanding if any consent of the guardian was given, particularly when self-administered surveys are used, remotely, of course.
Okay. And I mean, it's a fantastic question. It's something that frequently comes up. There are no, as you've probably noted, there are no easy answers, but I will attempt to kind of unpack just the thinking that needs to go in around it. So, and one thing I think we haven't articulated is what IVR actually is. So for those of you that don't know it, it's interactive voice recording, which means that it's not a person at the other end of the line. It's a pre-recorded survey, and people can basically just, respond, if, they have a selection of answers, and they can kind of respond to the answers, respond to the questions. So it's actually, there's not another person, which is can be particularly useful for kind of privacy purposes. But in regards to young people and kind of getting consent, it is problematic. And it's one of the things that, particularly have a look at the literature around being online, it's one of the biggest contentions. How can you prove? How can you ensure it? So in terms of thinking about it, there are a number of ways forward, a number of ways to kind of manage it, though they may not be perfect. So in the first instance, if you've got an interactive voice recording, you could actually have someone, which slightly defeats the purpose of having it fully interactive, ask, an adult to come online, and basically you just have to determine it via kind of voice. Again, it's not perfect, but say we first need to get an adult to confirm, and then get the adult to in fact provide consent, and then do the IVR with the child. Okay, that is complex, it's difficult, it's not necessarily easy, and it's not necessarily 100% accurate. You're going to get no really, truly kind of accurate way of determining that this person is in fact a child. The other thing is that we have certain platforms, for example, like YouReport, where they are all children, and in fact they have gotten consent for it. There are certain platforms where that's actually the case. What is interesting to note, and I don't think, I frequently come across this and people are not aware that when the privacy policy was released, it basically stated that we can get consent, directly from children over the age of 13. So you can necessarily target young people over the age of 13. Now, can they still say I'm over the age of 13 and not be 13? Yes. But that's kind of in terms of framing it. That's one way of doing it. Again, none of these are going to be 100% accurate and guarantee you're going to get the age range and necessarily the appropriate consent. But you also need to think about it in terms of, if you are going to say, well, we want someone who's kind of 13 plus, and we're only going to ask for 13 plus, so we don't need to necessarily get consent from parents. That has to be qualified by, if it is law in the country to actually have consent of parents, you actually have to have it. So it may be that interactive voice recordings can only be applied for a certain proportion of the survey itself, that it has to have someone kind of at the front end getting consent. And we really do need to think about the legislation. We also need to think about, well, it may be that there is no legislation. In a number of countries across the globe, there isn't this legal requirement for consent, not necessarily with social science type research, in which case you need to start thinking, well, still in that context, is there going to be an issue? What are the cultural and social norms? Are parents going to feel comfortable? Is there going to be a backlash? And this is something where you have to have an understanding of what the implications are if you don't seek consent from parents. Okay, UNICEF may have its standards, it may not have legislation, but there may be kind of backlash against it. And again, it becomes a reputational issue. We also need to think, and particularly when it comes to kind of, getting consent and etc., and working with children, one of the big issues we need to think about is whose phone is it? Okay, so this is another issue. It's not just about consent. We need to also think about whose phone it is. So is the child likely to own their own phone? If not, there are very real privacy issues in terms of, is there going to be a parent listening? What are the implications for privacy? Another thing we need to think about, if the child is sharing someone else's phone or needs to go next door to borrow a phone, what are the implications for COVID and for transmission? So just being mindful, we've just got to be absolutely mindful of, in terms of, particularly with children, when we're focusing on children, they will necessarily kind of, well, not actually, that's certainly not true. In certain contexts, they will have their own phone, but what are the implications of the fact that they will have to borrow a phone? And in which case, if privacy may be an issue, it's very important that, particularly if you've got someone who's actually doing the surveying, that person constantly asks, are you on your own? Do you have privacy at the outset? and kind of consistently asks that, just to ensure that it's that in fact, you know, that they do have the privacy and they can feel free to respond. So, and again, when it comes to kind of more broadly doing these remotely with adolescents or young people, is just be very mindful of the language, be specific about, you know, targeting age groups so that the language is appropriate, and, you know, wherever possible, particularly with children and young people, whatever the nature of the questions you're asking, if you can provide information, relevant information about services, so that we're giving back, we're not just taking. What I found during COVID was that there were a lot of people, it was like everyone wanted to collect data, but we have to get out of that mentality that we're doing good just by collecting data. It's like, no, we have to actually recognise that, you know, we are taking their time. This is kind of a privilege, and that we only, if absolutely necessary, should we be collecting this information. And we have to give back in some ways. And if that's, you know, if we're doing a survey about mental health, kind of providing, you know, information via SMS or WhatsApp about, you know, various mental health services they can provide, or social services, that type of thing. So kind of thinking about giving back. Now, I know, Tom, I've kind of gone beyond the parameters of consent, but I think it's just such an important question about how we engage with young people online. But one of the things that I think is kind of thinking about it is, if we do, given we do have some platforms where consent has already been provided, it may be a one way of thinking about it. Okay, thank you. It's a great question.
Thanks, Gab. Before I hand it to Hrayr for his question, just following up on something that you mentioned about when we are interviewing minors, children, over the phone, for example, right? And we want to make sure that they are on their own, right? We want to make sure we cannot see what the context is. We don't see whether other people are there sitting and listening to what's happening. So privacy is important, but there's also, we need to find that balance, right, between and it happens with face-to-face surveys. And I want to, this is where I'm coming with my question. So when we interview children face-to-face surveys, we want privacy, as in, we don't want anyone to be able to listen or to hear what we're discussing with them, but we still want to be visible to an adult, right? We don't want to be like in some room, like alone, you know, with a child without their parent or, you know, caregiver, just, you know, having that just visual, you know, idea where we are and what's happening. So how do we, you know, if this is any, you know, if this is an issue even at all in you know, in remote, but, you know, data collection, we don't, the risk may be less than in face-to-face interviews, but it's also a protection issue, right? So how do you respond to that? Or what would you, you know, if you have any thoughts about that?
I mean, I think it's a great question, and in some ways I do think it's lessened by the fact that you're not, I mean, the primary kind of issue about being, you know, seeing but not hearing is about this kind of safeguarding approach, and not being an adult, not being alone in a room with a child on their own. So that's kind of, but again, it may be, and this is where I think, but it's a really valid point in terms of particularly if we're targeting younger. I think for the kind of older adolescents, I mean, part of the reason that kind of it was decided 13 plus, because there's a degree of agency and responsibility, and, you know, that ability to make their own decisions and decide whether to participate, but also, and one of the things that we need to kind of emphasize, and hasn't been emphasized, I haven't emphasized it yet, is the importance of kind of making it very clear that if they don't want to answer a question, they don't have to. So if they're in a situation where they don't want to answer it because of by virtue of privacy, or if they don't feel comfortable, they don't. So I think that's kind of, it's more of an issue around younger people. And I think doing this kind of interactive and kind of, I'm very wary about doing remote surveying with younger children. I just think it's so complicated. And I understand that, you know, there are very real issues if we get to a stage where we're not doing that work. But given that things are starting to open it up, really, I think with younger people, it is better to do it face to face rather than, because of, you know, partly because of that, but also I just think in terms of consent, it gets more complicated. So it's not that we shouldn't do it, it's just that much harder. And I don't actually, with younger people, with much, you know, with younger children, one kind of conveying information remotely is very, very difficult. In actual fact, I'd say that, one, you'd have to get consent from parents, but two, also I would think like it would make a lot more sense to do it where there's access to the internet so that you've got the visual cues, rather than just doing it kind of through voice or recordings. So yeah, there's no easy answer to that. It's a great question, but I think it's specifically far more pertinent for kind of younger cohorts, and we just have to kind of think it through if it's absolutely critical that we do get younger cohorts, and if so, what's the best way of doing it? But no easy answers. Thanks, Eva.
Thank you. Hrayr, please come over to you.
Yes, thanks. I mean, it's very interesting, and I think we are. Yeah, my first initial question was a bit more attached to the initial approach. How are we, selecting and reaching out to respondents on the phone, and how do we deal with that insurance of consent, confidentiality, and so on and so forth. So from the engagement with our work with Gallup, and one of the issues that came up afterwards was initially the idea and the whole design of the approach and the methodology was about RDD. So we are having RDD across the board. So that was how we developed our tools, the questionnaire, the consent form, the text, how we introduce, how we ensure the, why and how are we contacting them, suddenly you're getting a call and how did you get my number, all these worries. So that was the initial discussion, and that's how we proceeded. But afterwards, actually quite afterwards, unfortunately, it was clear that that's not the case. And each subcontractor had different approach in how they were actually getting this. So one of the things that they discover is that some are using, as Tatjana was pointing out, there are lists. It can be from registers, but usually private companies or market research companies, polling companies have what they call these curated lists, which are usually what they accumulate over by doing phone surveys, CATI surveys, and they use those as basis just to tap in. Yeah. That was one of the other ways they were using. Another was exactly you can buy lists from another company to use those. So there was this mesh of different, approaches going out. So one thing I think was clear that do we need to maybe bottle these different approaches and be more specific on what are the issues when it comes to anonymity, confidentiality, consent, and how do we approach this and still safeguard and do our minimum ethical responsibility. So the question is, are there any differences and how we should approach when it's still we're talking about the basics of how we're approaching and contacting the respondent, not even the rest of it?
I think, to be honest, Hrayr, you've kind of dealt with and had to deal with most of the issues. And in some ways, I'd say, you're probably more the expert than I am. But I think for me, the approach is to really understand where the data is coming from, how the data was collected, what are the implications, how frequently the databases have been used in terms of how you do it. And again, I think we kind of need to, just for the audience, to be really clear that RDD is randomized digital dialing. So it's basically you're given the numbers and then it randomly chooses numbers. And one of the advantages of that particular system is that you can actually mask the numbers so that, so that the enumerators are not necessarily seeing what the number is. And so it's particularly good can be particularly good for privacy. But I think this is one of the things that you've raised a kind of really critical point in terms of just being very, very mindful around where you're getting the data from, how they get the data, how many surveys have they done, what's kind of the nature of the surveys they've done. So I think for me, it starts with the contracting process. Do they ever get, in some instances that they will have never, ever gotten consent. One of the things that particularly when it comes to third-party databases and UNICEF is that one of the things we have to do and is if someone says no, we will have access to, obviously, to certain details in certain instances where they've got a curated database where we do actually know the numbers. If someone says, no, we don't actually want to participate, at least from UNICEF's version of it, sometimes we won't have access to it, but when we do where it is actually handed over to us, we have to get rid of. If someone says, no, I'm not interested in participating, we have to get rid of it. Again, this is about being, respectful. again, we always have to provide consent. They can always say no, but I think if we do the initial work beforehand, we can get a better sense of, over surveying, participation rates, representation, but also, the ways in which, thinking about the organisation, if they've kind of gotten consent to put people on the database, what does, then we can say, well, okay, we're working with an organisation that is thinking through some of these critical ethical issues. If we're getting, what sometimes happens is we can get data from our partners. And that's another database that is frequently mined is, whether our partners are doing service delivery, they'll give us that. And again, we have to be very, very mindful of the reasons they had the numbers in the first instance, the expectations, etc. Is this going to inform our partners' programs? What does it mean? So our consent has to be absolutely holistic. If we're talking about very vulnerable populations, again, I would be very, very reluctant to actually take that database unless the service providers, and again, when they engage with these, their clients, actually ask them. So there's kind of this pre-consent. And again, we can see there's also the issue, I think there is broad consent. So there is the possibility that people can agree, if you frame it appropriately, that they are happy for people to contact them more broadly, if it is in relation to programs or etc. So you can actually get kind of broad consent to be called again and again and again. But I think we also need to be very, very mindful around how we get it. We're not going to be able to mitigate against some of these kind of critical issues around, people not wanting to be bothered and it being kind of invasive. The best we can do is, and this is one of the reasons I also kind of strongly encourage that if possible, and if it is kind of a random saying, we've got to think about saying to them, well, we're doing the survey. This is what it's going to involve. This is how long it's going to take. Are you interested? And when can we call you that's convenient for you? So again, it kind of really gives them the chance to kind of, but again, you may see, significant drop off, and then you also have to manage the fact, particularly if you mask the data, that you have to store the data. So then it becomes a privacy issue. So if we call back, it becomes a privacy issue because we're now collecting phone numbers. So you just have to kind of weigh it up, think about it. But first and foremost, you have to start at the point of understanding where the data has come from. And really, what are the implications in terms of privacy and access, over surveying? And really, there is no easy kind of answer, but particularly in terms of privacy, if you do the kind of RDD, and if it is on a computerized system, the advantage of that is that the enumerators don't actually have access to the information on whose phone number it is and or to that phone number. So it's never going to be used again. So yeah, no easy answers, but this is why ethics is an ongoing conversation. Thanks, Hrayr.
Thank you, Gab. And I think we're going to start our second round of questions with our panelists, and maybe I think we'll have time for a second round. Not sure about the third round, but again, I just want to remind the audience that if they have any reactions or thoughts or questions that they want to share during the panel discussions, feel free to do that. Tatjana, over to you now.
Thank you, Eva. It's not good that you said we have only one question. Now I want to ask all at once. Okay, so yeah, let me continue. So, okay, we have this a lot of consideration to take into account when we first call the households. But having in mind that we are calling them again, and we really need to give our best to reach as many households as possible. So to have this high response rate, because otherwise, yeah, we are wasting time and resources. So what we are trying to do is actually to collect phone numbers that not only one, because people are changing phone numbers, especially mobile phone numbers every day. It will depend on country to country, but in some countries it's really amazingly fast how those things are changing in a like minute, not even days. So we are trying to collect these phone numbers, and we had long discussions about this. Which phone numbers we can collect? Is it just respondent? Is it communal phone number? What this means? What I want to ask, okay, we have certain rules saying you can give us, and we are emphasizing this to the respondent, you can give us your phone number or communal phone number. But then we are getting a lot of questions from our partners, from national statistical offices, asking why we cannot ask all phone numbers that this respondent want to give us. Never mind, is it personal or husband or wife or, I don't know, brother, sister. And then when we try, of course, to explain, you know, you need to have a consent, you cannot call just person, then they are coming with additional question. But look, we call them from a register. We didn't ask for consent first time. Why this is different? You know, because even the first time when we called them, we didn't get the phone number with the consent. We took a phone number from the register. Mm-hmm. And now, you know, the people know what is survey about. They know we are calling them each month. Why it's not allowed to take additional phone number? And then again, at the beginning of the next survey, whoever picked that phone, we will ask for consent to continue with the interview. They can always say no. So these kind of things are creating, it's all with good intention, because we don't want to lose household, you know, because if we have one phone number and this phone number doesn't work in next month, we don't have other option to reach them. So we will lose them even if they want to participate. So it's not a classical refusal. They are saying no to the survey. We cannot just, we are losing opportunity to contact them again. So this is one of the really big issues. For now, fortunately, we have really high response rates. But yeah, our colleagues are trying to keep those on high level. So yeah, this is a question. I really hope we will have time for more.
Okay. And Tatjana, just you know, to be mindful that, you know, yourself, Eva, and I have discussed this in detail and kind of debated it, because it is so complicated, and there is a lot of push coming from governments to actually for people to just list as many phone numbers as possible. Now, our argument can be, and you know, what we agreed on is that they can do a communal one, they can do their own phone number, but handing out the phone number of someone else is something that we don't want to encourage. So that's, as you said, that's kind of the bottom line. But they're saying, well, what happens if they no longer use that phone? Well, the bottom line is it's partly about, you know, they can say, well, you know, it's about consent, but it's not just about consent, it's about privacy. Okay, so for example, if they were randomly calling someone and someone said no, they wouldn't keep their phone number on the registry, or, you know, or they wouldn't note down the phone number to call them again. So it's not just a consent issue, it's a privacy issue. You haven't actually, you know, we don't want to be collecting data for which, you know, someone's private data that we've got no permission to collect their private data, and we're storing it. So it's a really difficult one. We're going to have to say, well, you know, if you're looking for, well, anyone in the household, then perhaps the communal phone would work. So, you know, we can collect more than one, and this is what we agreed. We can certainly collect more than one if it is the one that the person is responding. If it's a communal one, then in the future, if they're not there, then someone else can pick up the phone and they can respond. Again, it's one of these kind of, I understand that they're trying to keep numbers up, but I also think that, you know, UNICEF has a reputational issue. And also we don't want to be collecting, you know, or the government to be collecting numbers kind of that, you know, because it's also a reputational issue. If you know, UNICEF is directly, you know, reputationally linked to mix. And if we're literally collecting massive amounts of numbers and constantly kind of calling people who haven't agreed to it, because someone else in their family has handed over the data, you know, effectively we're undermining the reputation that we're adhering to kind of strict ethical principles. Now, I know that frequently, you know, I accept the reality, the governments push back, and that ultimately they will do what they, you know, frequently they will do what they can, you know, they will do, but we have to kind of strongly argue that, you know, they can give us, if they say, well, you know, there's someone next door who I frequently share their phone with, because that does happen. Now, we've got to think about COVID, we've got to think about privacy issues, but if it is a phone that they use, it is a communal phone, then yes, you can include that. But again, I wouldn't be, you know, asking someone, and I think we can kind of think about it. And I know that doesn't kind of help when you're engaging with government who's pushing to get as many phone numbers as possible. But we also have to reflect on it and say, well, how would we feel if a member of our family said, here you go, here's my brother's or sister's or mum's phone number. Feel free to, you know, to use that, because we also can't guarantee that this won't be used for other purposes. That's the bottom line. So we really have to, effectively, the government will do what the government will do. But I think that as mix and as a kind of reputational issue, we have to say we aren't getting multiple numbers. We are allowing for multiple numbers. We cannot ask someone else to give consent for someone else's phone number, because we're keeping it on the registry without even asking them. It's not like we're cold calling them. We're actually noting it. We're keeping it in a database without any express permission. That's very different from cold calling and then saying we've got consent and then they're saying no and that's it. So I know that it's not a great answer. It really isn't, because I do know how much pushback you've gotten around this. But I also think that UNICEF has to, you know, we've seen a lot of scandals and a lot of issues. UNICEF has to do everything we can to kind of say, no, we know what the right thing to do is. We've thought about it. We've tried to be as much as possible, to be as kind of flexible as possible, but we have kind of basic standards to which we can adhere. As you know, that sometimes, you know, the mixed team kind of provides advice and the government does what the government does. But I think kind of as an organisation, we have to say this is our bottom line and this is our approach, and that we are saying multiple numbers. We're just not asking someone else to give someone else's, you know, and to therefore have something stored that you haven't got permission to be stored.
Okay, sorry, I will take one more minute. I have a follow-up. I really think it's important to emphasize. I think as a team, we are very proud on our privacy and ethical thing that we are applying in all our surveys. So just wanted to ask you how we are talking about privacy, okay, related to phone numbers. How this is different than other private data that we are collecting, because we all need to have in mind that we are asking parents about children. Okay, some of those data are really private data. So we have really strong guidelines and procedures to keep all data safe.
Yes.
We are using different anonymization procedures. We are now even, I think it's a lot of survey, and it will be all surveys. UNICEF will not have any access to names, addresses, you know, phone numbers. We are getting anonymized data, so we cannot connect them to the specific household or a person, which is, I think, good. So how phone numbers are different? Because somehow, sorry, this is just my personal thing. I know this is now emphasized a lot because of COVID, and we are all using remote data collection. So it's now it's on the top of all questions. But still, yeah, it's why this is more important than other data that we are keeping in our data sets.
Okay. And, you know, as I said, this is an ongoing discussion. There are no simple answers, but the answer to that specific question about why we're particular about phone numbers, we're not particular about phone numbers because we're actually asking them and saying, do you have a phone number? And do you have a shared phone number? And, you know, do you have more than one that you use? But when it comes to the other, the difference is that when we ask that data, we're asking private data of the person who's actually responding and has given consent. The problem for me is not necessarily collecting the numbers because you've gotten consent for it. The problem is that collecting someone else's data. Now, when it comes to parents, unfortunately, that's the reality of it. They're the guardians and they make the decision around children's data. And I think this is something that UNICEF, we really need to think of as an organisation, kind of how long we keep children's data. Because technically, when you think about the General Data Protection Regulation, they say we shouldn't be keeping data and data should be expunged and we need to be thinking about it. But the point being, there's a huge difference between someone providing you with personal information and someone providing someone else's personal information who's not a guardian or a parent. And as you'll see, and I think this is, hopefully this will come up, and as Tatjana said, like we ask one question and another question gets raised, which is why this conversation is so important, and why if in everyone's projects, if there is, if you are thinking of doing this, you really have to kind of go back and forward and kind of weigh up this need to gather data, how important it is, how we do it, how we collect numbers, how we approach populations, do we need, and as you'll see, that one question will raise another question, but we have to be asking them. This is the responsibility of the organisation.
Okay, thank you, Tatjana. Gab, over to you, Tom, for your next question.
Great. Yeah, I want to shift gears a little bit towards the content of the data collection, raising probably the classical question that you've heard a lot, Gab, and you've written a lot about, is asking sensitive information. No? Questions about sensitive information, and the classical one is around domestic violence and increased domestic violence. And, these were important issues, that as UNICEF we wanted to look at. And I think we've all, after having read a lot of what you've written, everyone is, what I've seen, is very cautious, extremely cautious about asking such questions. Particularly through remote data collection, of course, and particularly in a direct way. But I have seen then solutions being, alternative ways of asking around that. And one is then asking it in more indirect ways, asking about what the situation, about perceived situation in the community, or asking about behaviors in general in the family without specifically asking about that behavior, but then one of the answer options, points towards this. So these indirect ways of trying to collect data on sensitive issues. So just wanted to ask your reflection about, these more alternative ways of asking about that. What do you think about it? How do you stand on it? Because I have seen it applied. So what's your reflection about it?
Yeah, again, these are all excellent questions, and as I said, there are no simple answers, but there are also sometimes there are just organisational positions. And as a general rule, we know the organisational position is the best approach to asking sensitive questions is in person, is in face-to-face with someone who's highly trained and experienced, and particularly working on sensitive subjects. That's obviously the gold standard. We can't always reach the gold standard, in which case, as you said, Tom, what we frequently do is talk about, ask questions indirectly. So what's your opinion on, or what do you think, or do you think that this has increased? And it's a good way to get a kind of proxy for it, being mindful that, as has kind of been touched on, it's sometimes very, very difficult to get a random sample through remote technology. So given we're not kind of going to get, a random sample, we may not have already asked the question, so we may not have a baseline. It's very, very difficult to use kind of, in some instances, perhaps mix it will be possible. But unless it's been set up like that, to actually look at prevalence, things like prevalence of kind of some of these kind of sensitive areas, like, prevalence of kind of mental health issues, violence, etc. So sometimes and frequently remote data collection may not be the best option anyway. But also we have to, one of the things that I found, and as you said, I've kind of worked on this a lot, is that when you actually start unpacking what the goal is, it's frequently around more around kind of using it for advocacy, using it to kind of understand what our needs are. And really, I think the first instance, before you even start about kind of reframing the questions in a kind of very more indirect way, is what exactly do we need and why do we need it, and what's the absolute minimum that we can do in order to get that information, and can we get that information? Because what was happening a lot at the outset of COVID was that everyone was wanting to do prevalence studies on violence, particularly violence. I saw a lot of those surveys being done, and really they had no baseline. So you can't compare increases, you can't talk about increases, and again, you know, they were saying they wanted to talk about prevalence and increases in it, but their samples weren't representative, or they didn't have a baseline. So again, we need to first and foremost think, why are we doing it remotely? Do we have to do it remotely, and what can we genuinely get? So as you said, one of the approaches is to kind of do it more generically, to get a picture of attitudes, perceptions, indirectly, you know, do you think violence, you know, you can then say things like, if you're using it for advocacy, 60% of this particular sample of young people believe that violence had increased in the community. Okay, so perceptions can be just as valuable without kind of asking them directly. And I mean, another way is using that kind of interactive voice recordings, because that will give you the privacy, will cover some of the privacy issues, because, you know, they don't necessarily, there's no one on the other end, and they can just kind of put in their responses, and it can be, you can kind of digitize the whole process, so it's not kind of qualitative answers, it's quantitative answers, and they can just use the phone to respond. The problem with that is, if you're asking sensitive questions, you know, you really do want to be able to look at the young person, see if it's causing distress, see if they need help. And again, with an interactive voice recording, you can't then say, oh, you know, if the young person is feeling distressed, one, they can't, you know, the recording can't determine if they're distressed, and can't then ask, are you okay? Do you want to continue? Do you want to stop? I mean, again, you can do that insofar as you can pre-record every point saying, are you happy to continue with the questions? But again, so you've got to kind of, as a general rule, we try and avoid it. Where we do it indirectly. We try to think about what exactly do we need? Do we have to do it remotely? And, you know, what are the implications for privacy? And one of the things that absolutely has to be done, even if we're doing it indirectly, is actually having access, providing resources for the young person, or even if it's an adult and you're asking about violence, or asking about kind of mental health issues, or, you know, providing information and referrals. So, for example, during COVID, you know, some of the questions that were asked were around livelihoods. And, you know, in one particular country, you know, what they agreed to do is actually provide the hotline for actually accessing government social protection cash transfers. So kind of providing them with information, so how to get those cash transfers, alternately child helplines, that type of thing. So it's always, for me, it's always better if you can do it indirectly. Yes, you should do it indirectly. I would say asking personal experiential questions about sensitive subjects, as a general rule, I would avoid. But again, then you kind of start getting, and I've had this discussion around mental health. What is a sensitive question? How sensitive does it need to be? You know, and someone actually raised a very critical issue, and this was an academic who works in the mental health field. It's like, well, if you don't ask young people questions about mental health, are we going to end up stigmatizing it and making them feel like they can't talk about it? My answer is no, but you should never use IVR for those type of questions, because you have to have that point of contact. If you can use, you know, smartphones, whether there's a kind of, you can see the visual cues. I don't want to, you know, us to kind of stop asking questions, particularly about critical issues that young people may want to have a conversation, but we also need to be very mindful. And this is one thing that I've seen that, you know, I really have to stress quite a bit, is that there's a perception that merely asking questions about a sensitive topic is therapeutic. And that is simply not the case. We are not therapists, and enumerators don't necessarily have this background, unless you are necessarily, for example, recruiting psychologists to actually do this work. And that would be another consideration. If you are going to do it remotely, you can do it by phone, then perhaps get people who work on child helplines choose who your enumerators are. Even then, perhaps doing it indirectly, but if you can. And one of the things I always say is if you are doing it remotely, and I've seen it done really well through a U-report, they actually have large sessions with, young people can ask questions, but they have someone on hand that can be immediately referred to if they indicate that they need some help or they need support or they're at risk. So having someone there. Now, in some instances, that's not going to work. In some instances, that will work. But it is something to consider in the kind of the tools for kind of ensuring that we're, doing appropriate due diligence around child protection in these contexts. Again, not straightforward, not a clear answer, but we do what we can, being very mindful of why we need. And I've just kind of want to stress that there's a paper that I wrote in collaboration with Data and Analytics and with our office around that actually provides a decision tree around whether or not you should collect remote data collection on violence against children. And this can be, I think this can actually be used for any sensitive subject. So if you haven't looked at it and you're interested in kind of asking sensitive questions, I would go straight to it because it really is a very, very useful tool. So thanks, Tom.
Thank you, Gab. And I want to be fair, so I'm going to give Hrayr another chance to ask a question. We're sort of like running out of time, so
exactly. I mean,
okay.
to be honest, I think Gab, she went through the question I was planning for this one, but I mean, no, I mean it's good because now I can do my other question. But I think going from the content and how that can be sensitive, and then really figuring out through phone interview, what can be the response from an interview or from a CATI operator around if someone is reporting domestic violence or being at risk of harm. And also, that dynamic where, we don't have the face-to-face interaction to suspect if there is a risk of harm. So all those, questions that came up, even just a simple survey on impacts of COVID, where you have maybe in a household recent deceased from an impact of COVID, those kind of questions came up, like how do we then deal with if there's a stress, and then if someone on the phone, starts, crying or going in that direction, how do we deal with that kind of? But I think you already quite, unpacked those kind of interactions. So that was the question. But I think another point I wanted to bring out also before we open up the question is about recording of phone interviews. This is something that came up as well. With working with the polling companies with Gallup, they usually have a standard of recording their CATI through their CATI operations around 20-30%. They call it for quality assurance. And then when we were discussing, we want to keep anonymous the interviews. We don't want even to ask names during the interview. We want to disassociate any numbers after the call. So how do we keep that? And then since we are not asking names, it was fine. So the question was, after you get these recordings, there are sometimes identifiable names and information. So how do you deal with that kind of situation where, recording is one? How is recording, first of all, where are the boundaries of ethics around the recordings to begin with? And how does that reflect afterwards when, someone else was not part of maybe directly the research team is listening to this recording, a quality controller, even myself, I got the recording to listen to. So where does those end up, and how do we, safeguard within those aspects of also recording? So I stopped there.
It's, again, they're fantastic questions, and these things come up all the time. So as a general rule, I understand that there kind of is there is the importance of kind of recording for quality assurance processes, I think, but to some extent, I would say, first and foremost, the only way there should be a recording is if there's consent for recording. So if our partners say, no, we don't get consent, it's just part and parcel, then you actually have to say at the beginning in your preface in your consent process, if you do not wish for this to be recorded, please, we thank you for your time and cut it, because we absolutely, I mean, for me, the most important thing is if they are going to record it, because I mean, this does happen in face-to-face, and they do actually record, there's no doubt that there are people, there are enumerators who record kind of verbal conversations, and there are the data cleaners who also go through it. So I think that, you know, the same principles would apply. One, you have to get consent. One, you have to be prepared to accept consent. So if they say no, that's it. So either then you have to make a decision one way or the other, whether or not, basically not to collect the information and to say thank you, but, you know, we have to record it because it's that critical to record it, and or to either say, or to say, well, you know, if they don't want to record it, then it just doesn't get recorded, and then there are other alternate kind of ways of actually getting this information. So, I mean, that's, you know, in terms of, you know, someone's literally writing kind of hand notes, and or this is kind of you do a computerized process whereby it's just kind of, there's no verbal responses, it's just kind of, you know, press 1 for this, press 2 for that, etc. So I think, you know, the main thing is kind of getting consent for it up front. Minimizing, if it is going to be recorded, there has to be a justification for it to be recorded in the first instance. I would say, you know, if it's for quality assurance, I'm on the fence about. If it's for kind of note taking and it's absolutely critical to get, and particularly with qualitative research, sometimes having the recordings is very, very necessary for those that are transcribing it. And it's very difficult to do it without it. If you can avoid it, if it's necessary for actually recording the information, if you can avoid it for quality assurance purposes, great, but always get consent. And also always minimize the number of people who have access to it in the first instance. And I don't know if it's possible with some of these computerized systems, but wherever possible, where personal information is divulged, if that can be redacted, it should be redacted from the moment someone is cleaning the data or making notes. And that's part of the contract, that they actually, that if they do come across this personal data, that the person who's doing the data cleaning actually gets rid of that personal data. It may or may not be possible, and then you have to think through the consequences of it. But this does happen offline, you know, where we collect it, and we do need to think about it, and we need to say, is it absolutely critical? And if it is, we have to minimize who has access, and we have to ask consent. Thank you.
Thank you. Thank you very much. I think we've talked about a number of issues that I think each of them probably could take yes, hours of discussion, as we all know, because we've been involved in very complex conversations around consent and, you know, sensitive questions. And, you know, now, you know, Hrayr brought it, the issue of also partnerships with private vendors and contractors, which is a complete other, you know, full dimension, and brings the issue about accountability and how much and can we enforce and ensure that, you know, some of these ethical principles are applied in data collection. But I just wanted to give, like, we're like 10 minutes to the end of the webinar, and there are a few questions from the audience that I would just like to share with the panel. So for, you know, some of them I believe have been already addressed, but I'm going to start maybe with a question for Tatjana. What is the protocol for randomly selecting an adult to self-report in Mix Plus? And then we'll have another question that maybe someone you can think about if they want to take it up. It's what do you think about offering compensation for, you know, survey participation? Is that ethical, and any considerations to keep in mind? And maybe we can start with this too, and I'll share other questions later.
Thank you, Eva. In the Mix Plus, we are actually not randomly selecting the adult. There is no selection process as a process. We are actually interviewing any adult who answers the phone. What we are trying to do, this is for the first call when we start the survey. We are trying to talk with the same respondent in next months. But if this person is not available and another person wants to participate and answer the phone, we will interview that person. The most important is adult, and then of course that we have a consent. And I think, yeah, Gabi will answer on incentives, and yeah, that was one of the questions. And I think it's important because all are interested. Can we offer incentives, and how this will influence on everything?
Okay, so I mean, I'll quickly respond, and then if you've had the same, issues and how you responded to it. As a general rule, UNICEF doesn't have a blanket prohibition against providing some payment or compensation, and we also need to be very mindful in particular countries and in kind of the lower income countries. Even if you talk for a certain period of time, you've got to be mindful that basically phones take electricity, and electricity can be incredibly expensive. And so we have to be kind of mindful that we're actually not just extracting information and not giving back. I mean, some of the frequently what is done is they provide phone credit, etc. I mean, we have to be mindful not to kind of skew it so people feel compelled to in order to get the compensation, but to get the payment. But we do have to make sure that we're adequately compensating for out-of-pocket expenses, and we do need to be mindful that calling people via phones is not necessarily always cost-free. Phones need to be charged, and particularly older models of phone take a lot of electricity. And in certain countries, electricity is incredibly high, and also credit is incredibly expensive. So you've got to think about the context, and then we don't have a blanket, we prefer not to, but we also want to absolutely make sure that we're being fair, that we're actually compensating and make sure that no one is out of pocket by virtue of the surveys that we do.
Thank you, Gab. I think, well, there's a question from Sarah that has been, I think, addressed already. And Attila has a question about the ethics of reporting, which is an interesting, he's bringing up an interesting angle, saying basically many of the remote data collection initiatives do not provide methodological details in their reporting, right? So they don't mention anything about what they did to address ethical concerns. And they sometimes report on results that are based on very low response rates, like as low as 20-30%, and they treat these results as if they were representative, and then they use them to come up with policy recommendations. And so, okay, is there anything we can say about that? Ethics in the ethics of reporting.
Well, I mean, okay, very, very quickly, we have a requirement for it. Bottom line, it's in our ethics procedure. It's one of the ways we learn from each other. It's one of the biggest issues, I think, as an organisation we have, is that we need to share this learnings much more. And that was one of the reasons that in the very first procedure that was written, and included in the next update, is a requirement to report on this. It's partly to show that UNICEF has a commitment to this, that we have thought it through, and it's part of our kind of obligations to also to be in learning organisation. So it is absolutely a requirement.
There's a question, I think, from Valentina that I believe has partially been addressed already. Like, what she's asking about, what if I wanted to, analyze, secondary household survey data from, and then do a sort of a purposive sampling of respondents whose answers highlighted bottlenecks that, I'm interested in, exploring farther, right? And so if I am going to follow up with more in-depth qualitative interviews and learn, about, what worked and what didn't work in program delivery, it would be ethical and respectful of those program beneficiaries, right, to just reach them out. If, we don't know whether they agreed to be contacted for, future surveys. And I believe we have discussed this earlier. This is not ideal, right? But I mean, we need to make sure first, whenever we're using a database of phones or, and we just need to make sure whether first there was consent, informed consent that was sought at the beginning. And if not, then it's always about also looking at the risks and potential risks and benefits of this data collection exercise, and then to make the decision about whether to go ahead with it. And in absolutely any case, when we reach those respondents, the first thing to ask is, to obtain is informed consent, and ask for their, make it clear that their participation is voluntary and respect, and give them the opportunity and the possibility to refuse not to participate. I don't know if you want to add anything.
Just to say that, and it's a related issue, and it's come up quite a few times. Okay, if you're a secondary doing secondary data analysis and it's not your data sets, that's one thing. One of the things I found frequently and that a number of people have gotten in trouble about is that they've kind of done a survey, said we're going to use it for this purpose, and then subsequently decide to actually reuse the data, which we should actually actively be encouraging. What I'm saying is really, really do think about that when you write the informed consent. Think about the possibility that it may be used and note that in the consent. Another thing is if you are using someone else's data, I think it is appropriate to kind of say, listen, this is, I've accessed it via this database as a basis of your response to this program. And if they say no, then you actually ask them, would you like to be removed from this database? Again, we kind of have to, just have some indication of if they're saying no, no one else should call me. We kind of at least need to, or make a note on the kind of database in some ways, if we can, of saying do not contact that person for anything outside the parameters of the original project. So that's a way of kind of giving back and of making sure that it's respected. But please, if you're thinking about doing a project and you think there's even a small chance you'd want to reuse the data, which, as I said, you should be encouraging it, please note that in the consent at the outset so you don't end up with these problems down the track.
Okay, I think we just have a couple of minutes, and I wanted to give Attila a chance to just say a few words to close this, because this is our last webinar of this series. But unfortunately, I don't have time. There are a couple of other questions. If you can look at them in the chat box and maybe respond. But I would just give now the floor to Attila to just close this webinar and the series for at least this year, this season.
Well, thank you very much, Eva, and thanks a lot to the panel, to yourself, to Tom, Tatjana, Gabrielle, and Hrayr. This has been a really great panel, a very important topic indeed. So we come to the end of this webinar today, but we don't only come to the end of this webinar, but to the end of the webinar series. We started this back in September, and we have done, this is the 16th in the series. And we are now going to be taking a break for a while. And then hopefully we're going to come back with another series very soon during this year. We covered a diverse set of methods during this webinar, ranging from Facebook data to U-reports to household surveys to censuses. So it's been really great. All these, I just wanted to mention that all these recordings of these webinars are on our SharePoint site for UNICEF colleagues. They can access them through the link that is provided in the email invitations. But I just wanted to give you the good news as well, that for those colleagues who don't have access to the SharePoint, we are just about to start our YouTube channel, and pending the approvals from the presenters, of course, for ethical reasons, we are going to be putting the videos there too, so that external colleagues who can also access these videos. I see a lot of value in these webinars, the participation during these webinars, the questions asked, the information provided during the webinars. But I think these webinars are also really great documents to leave behind, so that they become reference documents for people to go back to. So that's why this is really important. We will take a break. As I mentioned, we will start a new series still on data collection, of course. But the focus may not be, specific data collection methods in the new series. It might be themes. We might be talking about themes, data collection around violence against children, for instance. Or we can do cross-sectoral series. But if you have any suggestions on what we should be concentrating on the next series, please do let us know. And finally, in relation to that too, we're going to be sending out to all the participants of the 16 webinars an evaluation form very soon using Microsoft Documents. And we would love to hear from you on how you evaluate us on these webinars, and including your suggestions that you will be able to put into the form on the future webinars. So thank you very much. But I should say before closing, that at the front line of this, and this is hard to organize, believe me, has been Archana, who's going to put on her video right now, so that we can all see her. And I would like to thank Archana very, very much for doing the hard work to organize these webinars and facilitating many of them, and sometimes with myself, sometimes alone. So thank you so much, Archana. And thank you very much once again, panel. This has been a great webinar. Goodbye.
Thanks a lot, everyone. Thanks, Attila.
Thanks, everyone.
Thank you, Gabrielle.
Bye-bye.
Thank you. Bye-bye.
Bye.
Bye.
Bye,
Thank
everyone.
you. Bye bye, everyone. Stay safe.